Thank you so much, Kathy. It's my extreme pleasure to be able to introduce everyone to this year's award recipients. Part of the Foundation's work is to recognize excellence in research and practice improvement. Our first award is the Case Management Practice Improvement Award. This award pays tribute to the case management individual, group, or organization offering the most outstanding evidence-based practice program. It is a Foundation's sincere honor to recognize the Case Management Practice Improvement Award recipient to the West Suburban Medical Center Health Confidence Lab. The award will be accepted by their implementation team lead, Colleen Morley, Director of Case Management. Please welcome Dr. Morley.
Hello, my name is Dr. Colleen Morley, and I'm the Director of Case Management at West Suburban Medical Center in Oak Park, Illinois. I would like to thank the Case Management Society of America Foundation for this incredibly prestigious recognition of our project titled Health Literacy and Health Confidence, a novel approach to patient education to reduce readmissions, or, as we affectionately refer to it, the SimLab. West Suburban Medical Center is dedicated to education. We host a family medicine residency program, internal medicine residency program, and we collaborate with several local nursing education, social work, pharmacy, physical therapy, occupational therapy, and speech therapy programs, just to name a few. Education is a key to our culture, and it is in our blood. Health literacy issues are at the core of a patient's ability to be successful in self-management. Health literacy is defined as a person's ability to obtain, understand, and act on health information. And it is important to understand that while 36% of the population of the United States functions at basic or below basic reading or literacy skills, only 12% of the American population demonstrates proficiency in health literacy. And additionally, the individual's perception of how they're able to manage their healthcare needs or health confidence also needs to be assessed. Addressing patients' health literacy and health confidence is as much a necessity as identifying a patient's extra medical needs and linking them with the needed services and resources to provide the patient with excellent patient-centered care, promoting their self-advocacy and independence in alignment with the CMSA Standards of Practice and the CCMC Code of Professional Conduct. This project addresses improving health literacy and health confidence through a series of varied educational experiences in a circuit training or station format. Our journey began after I attended a conference on readmissions in 2018. I came back from that conference energized after hearing Dr. Eric Coleman speak about health confidence, and I wanted to develop an intervention for our patients with chronic conditions such as COPD and CHF while they were inpatient to provide focused education to increase and improve on their self-management skills and confidence. Backed by an exceptional physician advisor in Dr. Scott Levin, we pitched the concept to senior leadership, got approval, and began to build. Key stakeholders, represented by myself, Ann Montgomery, Director of Pharmacy Services, Mary Jo Soklas, Director of Respiratory Therapy, Susan Dolly, Respiratory Therapy Supervisor, Dr. Megan Bisping, Director of Rehabilitation Services, Ellen Walker, LCSW Manager of Social Services, and Kimberly Fisher and Samantha Heisch, RN, who are our transition coach nurses, made up the team to develop the format, the curriculum, and the flow of the patient experience. We were also joined by Ron Fielman from Total Home Medical Equipment, who loaned us sample respiratory equipment that we used for hands-on demonstrations. Each station addresses specific education points using different learning techniques, including teachback, surveys, video learning modules, and hands-on experiences. But the key is the dedicated face-to-face time and intervention with each discipline. And the response has been incredible. Readmissions have been reduced by 51.6% for COPD patients and 57.1% for CHF patients from the year prior. The pre- and post-skills inventory scores also rose from 39.6 out of 50 pre to 50.21 out of 50 post-intervention. And the health confidence scores likewise increased from 6.71 out of 10 pre-intervention to 8.74 out of 10 post-intervention. But most important to us was the feedback that we received from the patients themselves. Comments like, I got more knowledge and more understanding about my illness. I loved the personal one-on-one experience, or I liked it. It provided me with an opportunity for questions and options for improving my lifestyle, and I understand everything so much better now. It gave me good information, and they did not talk down to me. Or one gentleman, I wasn't sure at first. I thought it'd be a waste of time. It sure was not, in capital letters, a waste of time. So many people cared to take the time to do this. I've been to a lot of hospitals, and this experience was impressive, and I didn't even know something like this existed. Of course, in this time of COVID-19, just like anything else in healthcare, we will be working towards adapting this intervention to the needs of social distancing without sacrificing the core components of the program. So, many thanks to the CMSA Foundation for recognizing our project with the Practice Improvement Award. I am honored and thrilled to accept this award on behalf of everyone involved in the endeavor and West Suburban Medical Center. Thank you so much.
Congratulations, West Suburban Medical Center. What a great program. I am pleased to announce there is a second Case Management Practice Improvement Award recipient. The two submissions were scored similarly by the awards committee, and the foundation determined it should recognize each entity for their practice improvement efforts. The second recipient for Case Management Practice Improvement is awarded to Anthem Incorporated for their HOPE, which stands for High Outreach to Promote Engagement Program. The award is being accepted by Kelly Pennington, PhD, Staff VP, Behavioral Health. Please welcome Dr. Pennington.
Good afternoon. My name is Dr. Kelly Pennington, and I'm the Vice President for Behavioral Health within the Government Business Divisions at Anthem. It is an honor today to be recognized by the Case Management Society of America's Foundation and their Board of Directors as a recipient of the 2020 Case Management Practice Improvement Award. High Outreach to Promote Engagement, or the HOPE program, is one of the many ways that Anthem strives to serve our most vulnerable populations. In 2017, it was our vision to create a program to meet the needs of our most complex members at Anthem across multiple lines of business. We sought to create an intervention to reach members in their communities who have multiple unmet physical, behavioral, and social challenges, requiring focused support to address those needs. As research has demonstrated, only 5% of the population in the United States accounts for 49% of the healthcare expenditures each year. Through the HOPE Case Management Initiative, we sought to identify and outreach to the members who fall into this 5% category. Many of the members we serve have high rates of multiple chronic conditions, both behavioral and physical health, and have higher than average emergency room and inpatient admissions. We recognize that to improve outcomes and lower costs, we can not only assess and address an individual's complex medical needs, but we must also address the social drivers of health. In order to do this, we must increase access to community care, improve how providers communicate with the individuals, and create a single point of contact for these members within Anthem's case management programs. HOPE case managers, who are licensed clinicians, serve as a central point of contact for members, responsible for supporting all aspects of services and supports, regardless of diagnosis. This unique approach provides direct person-to-person interaction with the member, allowing for stronger relationship building, better engagement, and a more complete assessment of the individual's environment. Additionally, they coordinate with Anthem's wellness and recovery staff, who are certified peer support specialists. Peers, having the lived experience of mental illness or a substance use disorder, provide an invaluable support and assistance to members with similar backgrounds. As of May 2020, we've had 3,535 members referred to the program since the implementation in 2018, with a 69% engagement rate. We have also worked with approximately 2,500 providers during the same time period. We are seeing utilization decrease in emergency rooms and inpatient utilization on average of 49% as of May 2020. However, none of this would be possible without the support of Anthem's leadership, who have provided ongoing support for our creativity and our efforts to reach this difficult population. Also, our program leaders are tremendous. Lori Sincata, Rebecca Harvey, Lindsay Langmo, Angel Strange, and Deidre Williams, all terrific leaders within the HOPE program. And lastly, but certainly not least, I want to extend my heartfelt thanks to the nearly 30 clinicians who are working within the HOPE program each day with our members. They are truly doing the hard work, and I would not be here today without their efforts. Again, it is an honor to be accepting this award today, and I thank you.
Congratulations to Anthem, Inc. The Foundation is thrilled to be able to provide this recognition to 2 outstanding programs. We can't wait to share more about these award-winning programs and projects. Watch for further information in upcoming issues of CMSA Today, where you will be able to learn more about the projects that were submitted. In order for the CMSA Foundation to continue their mission and vision, we need you. Programs like the awards, scholarships, and grants aren't possible without the support of our members. We saw many members reach deep into their pockets this year so that other members could have the opportunity to attend CMSA National Conference this year. That support was amazing. But support for programs is an ongoing effort. It never stops. And to keep these programs going and have the opportunity to add even more programs and recipients, we need your support. We depend on it. If all gave a little, it would do so much and add up so much to help. The easiest for me has been a reoccurring monthly donation. I don't even notice 10 to 20 bucks each month going out of my account, and it's automated, so I don't even have to think about it. We have much more work to do, and we need each of you today to help us continue to reach these goals. We do need your help. We are members supporting members. The Foundation thanks you for your support of members supporting members. We support you. We need you. We have shown you many ways to support and contribute to your foundation. How will you support the CMSA Foundation this year? Will your name be on the 2020 donor list? Please join us as we move onward together. Thank you. I will now turn the closing session back to Kathy Frazier.